bad pain, they will bless you. So that is very important, not to just be knife happy. When required, it's a wonderful operation to put cement or kyphoplasty, but not everybody needs it. And similarly, in some of the vertebral fractures, they become so bad that you have to put screws around with the cement and stabilize them. Then there are other fractures associated with, osteoporosis, which is even more common or as common, for example, in the around the hip, for example, fracture neck femur. Now that is a very different ball game altogether. If fracture neck femur happens in an elderly person, this is an emergency. It should be treated as soon as possible. Mostly we would replace it by uh, either a half or a full replacement depending on the age and other factors, because the sooner we can mobilize the patient, the more the chances of survival and being good, and the more you delay, the worse are the results. And again, even if there are some other diseases and there is a fractured neck femur which is not in position, even if the patient's condition is bad medically, it's very important to operate and change that hip, because that's the only way to survive. Sometimes people say, oh, it's a bad risk. The higher the risk, the more an emergency to do it. So people should be educated in that the only way you can survive is by being early. That is very important. As in vertebral fractures, you can still wait. Similarly, there are fractures around the wrist. There are a lot of fractures which happen in osteoporotic fractures around the wrist. So they also, most of them can be treated by just bringing the wrist into proper position and either a plaster or something, or one or two wires from outside the skin. Very less commonly you require a plate or something. So to cut the long story short, try and treat non-operatively, but fractures around the hip, surgery may be very important. And in osteoporotic, if there are fractures, there are techniques different than normal fractures, because sometimes you may have to put more screws, you may have to put longer plate or whatever. Those are technical matters. I will not go into that. But important thing to emphasize is in an elderly person, fractures around the hip, if it's a displaced, is an emergency, and do not be afraid to get operated. That's your chance to survive.
Thank you, Dr. Gulati. Amit, like Dr. Gulati said that, these are these different postural defects which happen with elderlies. So would you say a posture corrector belt or a hip protector, is it a good practice to wear it on a regular basis after 60?
No, because it can give proprioception that you are sitting correctly, or if you are hunching forward, so they can give you sense that you should keep erect. But permanently using it is not the correct idea. You can wear it for the few hours, or you can use sometimes in a day just to correct the posture, just to maintain the posture. But wearing it permanently is a good idea, because your muscles get rely to it, so it will not work on its own. So there is big no for that, to wear it every day or wear it full day. For some time it's okay.
If you're traveling or something in the car or something, I guess it should be.
It is short duration travel, it's okay, no problem in that.
You see, you should use them only if there is pain. It's only for temporary pain
Yes.
relief.
Yes.
Not otherwise. If you don't have pain, just osteoporosis, absolutely not required. Only temporarily for pain management, you can use them.
Dr. Gulati, what do you say about continued collagen supplementation to help with bone health? Does it help?
Collagen, usually you don't give it for just bone health. There are some preparations which you give for, cartilage enhancement and all that. You see, they are of doubtful value, to be honest, at the best. But in very early stages, you may use them because there's nothing else to offer except painkillers. Sometimes they may help, but I've seen people using them for years and years. Absolutely, for them it is, that chalk powder. There's no need to do that. I think waste of money. But for short duration, in early stages, maybe it can help. Maybe. I'm not too sure. Nobody is sure. But in late stages, when there is all arthritis and bone is gone, and cartilage is totally gone, it's a waste of money. So don't do that. There's no point.
But does it have any side effects, Dr. Gulati, collagen to be taken? Because nowadays
There
you
are
can
very
see.
few side effects. Some people, I'm telling you anecdotal, some people say that when we take them, we gain weight. Maybe, but otherwise they are food supplement. They should not have any major side effect. Not really.
Because you see nowadays there is a lot of collagen which is available off the counter all over the world, and women are having it, especially 40 plus
Yeah, but
women.
you see,
They
some
are.
people have to make money. They find methods.
Yes, Dr. Gulati, which brings us to the end of this. Before we go to our questions, the audience questions, top 5 tips to manage bone health.
Top 5 thing I've already told you: activity, activity, activity. These are 3 tips. Okay, these are the most important, most important. And then you should keep your postures correct. You should look after your diet. Take balanced diet, which is balanced between carbohydrates, proteins, and fat. Don't not take fats. That's a myth. Don't not take proteins. So take in proper proportion, and do your stretching exercises, walks, jogs, really, and take care of your vitamin D's and all. If you have unexplained pains, you should just get yourself checked. And if these are very simple methods to treat them, there's no big deal about it at all, and results can be very good. If one day I've seen people who could not walk, and 3 weeks of vitamin D, and they are running around. So it's very, very important to take care of this thing. But again, most important thing is activity. There's no other thing more important than that.
Mr. Amit, what would you say? What would your 5 things would be to manage bone health?
If you are already diagnosed, then first one should be from the doctor's side that one should get plenty of calcium and vitamin D. Second one should be you should exercise regularly, for example, weight bearing exercises, cycling, and all. Third one should be eat healthy diet. And fourth one, avoid smoking and alcohol. And fifth one, always keep mind relaxed and think simple.
Thank you. Thank you. So let's get to the audience questions, because I think we have quite a few of them which are there. I think the first one, Dr. Gulati, what would you suggest? Basha, I suggest for diet part to reduce any deficiency in the body in perimenopausal stage.
Well, I think we just talked about it quite a lot.
Yes.
Take balanced
Yes.
diet, make sure that you have fortified oils or ghee or things, and take your green leafy vegetables and protein and fat in proper proportion.
And Aparna wants to know, Dr. Gulati, can you reverse osteoporosis after
Yes.
menopause?
Yes, you can. You can reverse osteoporosis. The important thing is not to reverse the figures. The important thing is to reverse fracture risk. Sometimes, in spite of all the medications, if you go and do the bone density, you find that, with the same figure or not much change, but it has been proven that the fracture risk decreases in those cases. So yes, the answer is yes.
Should we take regular calcium and D3, and at what age? I'm 50 plus right now, but on perimenopause, severe D3 fall. She says her count is 15 and a lot of pain in her legs.
Yeah, so you should take vitamin D for once a week for 4 months, calcium every day, and later on you can start taking vitamin D once in 2 weeks, and then even later once a month. And calcium initially every day, then every alternate day. So you can take it for months or years. That's not an issue. As I said, oral medication doesn't hurt.
Yeah. So the other one, well, again, it's the same thing, that first initially hot flashes, then sleeplessness, and now legs pains. She has severe leg pain. So
I think the same thing will apply. And those perimenopausal hot flushes and all, I think the gynecologist will give some hormone
will be
things
able
in.
to. Yes, totally. The next question is also, I think, can you ask if endocrinologist will help with hormones, or gynecologist? I would tend to think the gynae would do better in this.
Well, I mean, it depends. Lottery kar lo. Both are good.
Both are good. Which one would you actually recommend, doctor? Would you say for
I think
hormones,
your
the
gynecologist is well aware of your situation. So, I mean, I would, for this reason, go to a gynecologist.
okay. And Aparna asked, should one have a DEXA regularly after certain age or only once you start aches and pains?
Pardon?
Should you have the DEXA scan regularly after a certain age or only once
Yeah,
you start
if
aches and
you,
pains?
those who can afford it should have it around the age of 50. And those who
And
cannot afford it,
how
and once you
frequently
do
would
it,
you
then you
see?
don't need to do it for another 5, 6 years.
Okay, okay.
There's no point doing it. If it is normal, don't do it so often. And even if it is not normal, there's no point repeating every 6 months. So I've seen some paranoid people doing it. It is not required.
Okay. And doctor, which are the common fractures in menopausal age group?
Well, not really menopausal. I mean, these would be if somebody has osteoporosis, then you can have those vertebral fractures or fractures around the hip or wrist if somebody has osteoporosis, but it's not because of menopause.
And Ritika asked, should we take regular calcium or give break every 3 months? That is a really good question because a lot of times you hear this that you
It's
should
really
give break.
anecdotal. There is no scientific answer to this. I mean, the scientific answer would be do your blood test. If you're not deficient, don't take. So then don't take. And if you are taking without doing tests, then maybe take it for a few months, give it a break, and then take again. The scientific answer would be to do test and see if you're deficient, only then take vitamin D or calcium. Otherwise, no need.
And which is the best exercise in this? I think this probably would be for Amit, which is best exercise in this age, weight training, resistance, or yoga?
See, go stage wise. As I said, you should start with low intensity exercises. Then you can go for high intensity exercises. The third one, you should go for strengthening exercises, and after that, the last one should be stretching exercises. To start with, you can start with simple yoga, walking, swimming, and for high intensity exercises, you can do the high intensity exercises for 30 seconds, then you can rest for 60 seconds. That is the second stage exercise. The third one should be strengthening exercise, like deadlift, weight training. So all that you can do, that should come into the third part. And after that, after all the exercises, you should always go for post recovery exercises. If there is some muscle stiffness or some tenderness is there, then you can prevent it with the stretching exercises. So you can start and you can sum up the exercises by the post recovery stretchings.
Amit, what do you say about massages? A lot of time you hear people getting massages done that, oh, I have a backache or, or leg ache or whatever, and you go in for a massage. So would you recommend it, not recommend it? If you're osteoporotic, is it recommended, not recommended? Just
First of all, you have to see your orthopedician that what is the cause of the pain first. So according to the cause, one can go for massages. If the bone is so much osteoporotic, you should not go for extensive massage exercises because it can lead to the fracture of vertebra or around the hip.
okay.
So
Thank you,
one
Amit.
then
Yeah,
go for exercise.
but
And the
otherwise massage helps.
Yeah, and the exercises should be physio recommended, and it should not be like that you are going for extensive stretching. That can also lead to the fractures because of the osteoporosis caused in the menopause.
Okay, thank you, Amit. Dr. Gulati, Dr. Pooja wants to know, what is this new injection Prolia?
Before I say that, I just have to say I have a flight to catch. So if there are one or two questions, please ask.
Yes,
Then I'll have to leave.
yes,
You know.
yes,
Okay,
sure.
this Prolia is a trade name. It's actually a denosumab injection. That's the pharmacological name. This was used in treatment of some type of cancers in which the bone was very weak to shrink the tumor so that you could remove it easily. So it's a bone forming kind of an injection. And now it has become very popular with people because it is easy to give, just like insulin, one injection in 6 months. I am not too fond of it, not as a routine, because I think there are cheaper and simpler options available orally. After all, it's somehow my common sense doesn't encourage me to give it too often. But this is very good if somebody has kidney disease, and then if you can't take other drugs, this is then the drug of choice. So I think it should be reserved for certain situations when other things are not working. And also remember, if somebody starts taking denosumab, then you have to take it for life. This is sometimes people don't understand, because if you stop taking it again, you are back to square one. So this is very important. Denosumab cannot be stopped in between. So I normally don't use it that often unless I have no other options. I use it very sparingly.
And Dr. Gulati, are naturopathy and wellness resorts good to cure menopause and side effects?
I don't think anybody can cure menopause. This is physiological situation, but symptoms related to that, I think, yes, and naturopathy is wonderful in many ways. You see, what after all, yoga is what? Is part of naturopathy. Walking is what? Is part of naturopathy. And doing exercise is part of naturopathy. If you talk about naturopathy going in expensive resorts, that if you have a lot of money, you can do that. But you can do the same naturopathy at home. So if you have money and if you feel good about spending money on yourself, yes, those resorts are very good. But these things can easily be done at home. There's no big deal about it.
So there isn't really that you need to rush to a resort to do any of this.
I mean, what resort for what?
Yeah. Ritika wants to know, PRP for hallux rigidus works?
See, PRP it's claimed that it contains some um, stem cells, which sometimes we use it for osteoarthritis. But once you are in a situation of hallux rigidus, that would mean that there is a lot of arthritis already, which has caused it hallux rigidus. Let me explain for people who are non-medical people that the great toe becomes rigid and you not move it up and down. So that would normally happen because of severe arthritis. So the treatment for that generally would be either some kind of a insole for in early stages, and in late stages it would be surgery, either in the form of fusion or excision, or even joint replacement is available. So depending on age and many other factors.
Okay, Dr. Gulati, thank you. Thank you for being there and for explaining everything so easily and for busting so many myths which people had. And we are going to let you go because we know you need to
Thank you.
catch
Yeah,
a
I
flight.
think the importance of these kind of meetings is more of removing myths and more of bringing common sense into approach. And
Yes.
again, it is only common sense that if you are active, you are working around and walking, and your body will stay healthy. It's common sense. So just use that. I think that's what it is.
Thank you. Thank you, Dr. Gulati.
Thank
Amit, we
you.
have a few questions for you. So, Dr.
Thank
Gulati,
you,
if you would
Glossy,
like
and
to
thank you
please.
very much, ma'am, for bringing me over to the program. It was wonderful.
Thank you.
Thank you.
Thank you. Thank you, Dr. Gulati. Amit, we still have a few questions for you. Some daily exercises easily, which can be done in the house for daily, for something which can help us during the menopausal transition.
See, if you are already diagnosed with the osteoporosis caused by perimenopause, you should go for normal exercises. Like you have to start the exercise with your own body weight. Like you have to lift your shoulder with the hand weight only. You don't have to put excess weight or to put 1 or 2 kg weight. You don't have to do the exercises from your own body weight. You can go for walking, you can go for light jogging, you can go for swimming. These are the light impact exercises, which is not at all harmful for you. So you can start with this.
Amit, how effective are needles and acupuncture or acupressure?
Again, these are the needles and acupressure. All these are the pain relieving. Like if you have pain over some local area, then you can use needles or acupressure. You can to relieve the pain. It has to do overall for menopausal things you get. If you have local trigger points or local pain, you can always go for the needles, but not on the regular basis.
Not on the regular basis. Do
Yeah.
they have any side effects?
See, it depends who is doing. If the needle is going somewhere on the nerve part or it is damaging the artery, it is always what it can do. So you can do only on the muscles and also on the part not getting stretched or not getting relieved by any other things like heat or massages. Then you should go for needling.
Amit, what do you say about a chiropractor? Are chiropractors safe to go to?
See, in India, it always like some fashion comes and goes. Chiropractor is good if you know that your bone alignment there, it is good. But going on fashion basis is not good because chiropractor they do some of the movement which do the laxity of your ligaments. Like in the spine, they always crack the thing, but the ligaments around the spine get laxity. So in future, again, if the laxity is there, simple small movements can cause fracture. They can cause disc prolapse. So you don't have to do it permanently. It's just a cosmetic things right now. And in India, there is no one who is 4 years or 3 years certified chiropractor. Everybody has done diploma and just writing chiropractor in front of their name. So I will not recommend on the daily basis. If there is misalignment in your joint, you can go, but not on the daily basis.
Thank you, Amit. Anything else that you would like to tell our women to take care of their bone health or how to take care? What would you recommend before we close this?
Looking nowadays scenarios, first of all, menopause is not a disease. It's just you know that you have estrogen hormone, which is responsible for any activities going on in your body. If there is estrogen decline in your body, the formation of the bone on the normal pace is not there. So what you can do, you can change your lifestyle, you can change your diet plans, you can change your exercise regime, so you can live a better life along with this also. So it's not a you can say it's not a disease. Take it lightly and go according to the flow.
Thank you. Over to you, Megha.
Immense thanks to our esteemed panelists, Dr. Yash Gulati and Amit Pandey, for such an insightful session. Abundant thanks to Nandini for recognizing the need to address this crucial concern. And many thanks to the Secretariat for the relentless support each time. Dr. Glossy, Dr. Pooja, and Aparna for their very, very diligent and enthusiastic curation week after week. And abundant thanks to all the members under the Health and Wellness vertical for their active participation and meaningful inputs. Thank you so much. I think we had a very, very informative, insightful session, and everyone who's attended it is going to benefit from it. Thank you. And we look forward to the same audience and bigger audience next week as well on the 23rd to address more concerns on menopause. Thank you, everyone.
Thank you. Thank you, Megha.